Hard Flaccid Syndrome, what it is and why Google makes it worse. If you've been searching for information about Hard Flaccid Syndrome, you've probably found a lot of anxiety, a lot of forum posts from men who are worried and not a clear clinical answer. In this episode, I want to give you that answer clearly. What it is and what it might be causing it and what actually happens. I'm Steve Carter, founder of Male Health Clinic here in Beeston, Nottingham. Hard Flaccid Syndrome is something I see regularly in clinic, particularly in younger men, and it's a condition that deserves a proper explanation. Hard Flaccid Syndrome, or sometimes called HFS, refers to a persistent state where the penis feels hard or rubbery when flaccid rather than soft. It's often accompanied by other symptoms, reduced sensitivity, retraction, pain or discomfort in the pelvic area, and changes in sexual function. The symptoms can come and go, and they can feel fairly constant. They're often worse by sitting for long periods, physical activity or stress. What's important to understand is that Hard Flaccid Syndrome is not a single disease with a single cause. It's a cluster of symptoms. Those symptoms can have several different underlying drivers. The most common of those drivers in my clinical experience involves the pelvic floor, specifically pelvic floor hypertonicity, which means the pelvic muscles are in a state of excessive tension rather than functioning normally. Most of these difficult things about Hard Flaccid Syndrome is the one that is poorly represented in mainstream medicine. Many GPs haven't heard of it. Standard investigations often come back normal. Men are told there's nothing wrong, which understandably makes everything worse. The internet fills that vacuum, and unfortunately the internet tends to fill it with worst case scenarios, permanent prognosis and conflicting advice. If you spent time in online forums about this condition, I understand why, but I encourage you to treat what you find there with some caution. Individual experiences are not the same as clinical patterns and clinical evidence. The most important thing is a proper assessment, one that actually examines the pelvic floor, assesses muscular tension and coordination, and rules out other contributing factors. For many men with hard flaccid, pelvic floor rehabilitation combined with addressing lifestyle factors like prolonged sitting, posture, and stress produces meaningful improvement. Shockwave therapy is also proven and has a role in some presentations with hard flaccid, particularly where vascular or nerve-related components are involved, and there's evidence that is supporting this and growing all the time. There is no single protocol that works for every man with hard flaccid, which is exactly why a proper individual assessment matters more than a generic treatment plan. If you've been living with these symptoms and struggling to find clear answers, I hope this has helped. You're not imagining it. You're not out there out of options at all. There is options out there for you. Subscribe below for more honest content on men's health. And if you'd like to understand what's going on in your specific case, we offer a free confidential informal chat where the link is below in the description.